head-to-toe assessment on you. It's going to take about 15-20 minutes. Do you have enough time for that?
Yeah.
And do I have permission to touch you?
Mm-hmm.
Cool. So we're going to be using a stethoscope today, deep tendon reflex hammer, otoscope, pen light, and a tongue blade. So we're going to go ahead and get started if that's okay with you.
Yep.
My hands are all clean.
Mm-hmm.
Alright, taking a look at the patient's head, it is normal cephalic. There's no signs of microcephaly or hydrocephaly. No visual nodule lesions or masses. We're going to take a look at the patient's hair. Patient's hair is black in color, dense, coarse, evenly distributed. Take a look at the back of the nape. There's no signs of pediculi or parasites, and there's no patchiness, so no signs of alopecia. Moving down to the patient's face, there's no signs of any involuntary movements or tics. Color is consistent throughout. Facial features are bilaterally symmetrical. Patient's eyebrows are black in color, bilaterally symmetrical, evenly distributed. Eyelashes are black in color, evenly distributed. Upper eyelashes curl upwards, bottom eyelashes curl downward. Now we're going to take a look at the external structures of the eye. The eyelids are free of any signs of ptosis, no infection, drainage, lesions, masses. The outer canthus slides up with the pinna of the ear. We pulled out the conjunctiva. The conjunctiva is pink in color, moist, no signs of dehydration, infection, drainage, or lesions. The sclera of the eye is white. The cornea is free of any cloudiness, and the iris is brown in color and consistent throughout. We're now going to assess the 6 cardinal fields of vision. So go ahead and follow my pen light with just your eyes. Patient was able to follow the 6 cardinal fields without any signs of nystagmus. Now go ahead and look forward for me. Corneal light reflex is even in both eyes at the same position. I'm going to check now for pupil dilation and constriction. Right constricts upon stimulation of light. Left constricts upon stimulation of light on the right, and both dilate afterwards. Can you please take a look at that point up there, and once you see my pen light come in, go ahead and focus in on it. Patient's eyes converged upon the pen light and their pupils constricted. Now, I'm going to test your cranial nerve 7. Go ahead and wrinkle your forehead. Raise your eyebrows. Smile. Smile with teeth. Frown. Purse your lips. And whistle. Awesome. We're now going to move on to the ears. We're going to palpate the upper auricle. Any pain or tenderness here?
No.
The tragus. Any pain or tenderness?
No.
No signs of mid-ear infection. And the mastoid process. Any pain or tenderness?
No.
Good. Now we're going to take a look inside the ears. We're going to pull the ear up and back. We take our otoscope. We put the batteries in. We flip it upside down. We take a look inside. Inside the ear is reddish in color, no signs of any discharge or drainage, normal amounts of cerumen, no nodules, lesions, or masses. Tympanic membrane is pearly gray, translucent, convex, free of any perforations. Cone of light is at 5 o'clock. We're now going to perform the whisper test. How this is going to work is you're going to cover your left ear. I'm going to whisper a 2-syllable word. Whisper it back to me. Apex.
Apex.
Perfect. Whisper test is negative. Patient's cranial nerve 3 is intact. We're now going to move on to the nose. Taking a look at the nose, there's free of any nodules, lesions, or masses. Do you have any pain or tenderness in this area?
No.
Pain or tenderness?
No.
No pain or tenderness in the nose or sinuses? Go ahead and look up for me. Take a look inside. The nasal mucosa is pink in color. Septum is midline, no signs of any deviations or perforations. And there's no nodules, lesions, or masses. Go ahead and look down. Can you cover one nostril and breathe in? Now the other one. Patient has no blockages of the nostrils. We're now going to move on to your mouth. Patient's lips are pink in color, free of any cracking or crusting. Go ahead and open up for me. Oral mucosa is pink, free of any nodules, lesions, or masses. Pink and moist. Go ahead and close your mouth. Now we're using a sterile tongue blade. What I'm going to do is I'm going to stick it in your mouth and then just say ah.
Yeah.
Say ah.
Ah.
Uvula retracts up, cranial nerve 10 is intact, tonsil pillars were not visible, so that is rated at a 1+. Now can you stick your tongue out for me? Up to the roof, down, left, and right. Perfect. Now we're going to assess the range of motion of your neck. Go ahead and look up, down, side, side, ear to shoulder, ear to shoulder. Perfect. Patient has range of motion of the neck. Go ahead and shrug for me. Strength of 5 out of 5, and go ahead and turn your head against my hand. Strength of 5 out of 5. Now I'm going to move on to the upper extremities. We see that the color is consistent throughout besides the tan line. There's no nodules, lesions, or masses. Good muscle tone. We're going to now take a look at the hands. Skin turgor is good. Skin rebounds right away. There's no signs of tenting. Nails are pink in color, smooth, free of any ridges or splitting. Capillary refill is under 2 seconds. Alright, now I'm going to assess the range of motion of your elbows. Go ahead and straighten your arms out, flex in, and back out. Now go ahead and do it again. No signs of crepitus. Now pull against yourself. Strength of 5 out of 5 at the elbows, push against me. Strength of 5 out of 5. Now we're going to check for your hands and your wrists. Hands straight out like this, make a box, close it all the way out, go back, open up your fingers, close your fingers. Now squeeze my hands, strength of 5 out of 5. Go ahead and lift your hands up, 5 out of 5, and push down, 5 out of 5. 5 out of 5 strength for the hands and wrists, full range of motion. Alrighty, now I'm going to take a look at your breathing. Before we do that, actually, 5 motor functions of the hands. Go ahead and touch your thumbs to your fingers, alternate in a rhythmic motion. Alrighty, now to go ahead and alternate between touching your nose and both hands. Now touch your nose and touch my finger. Perfect. Now supinate your hands on your lap like this. Patient was able to do 5 motor functions in a rhythmic motion. Now I'm going to take a look at your breathing. Respirations are normal rate and rhythm. There's no signs of intercostal retraction. Chest rises and falls normally. AP ratio is a 2:1. And yeah, we're going to go ahead and inspect the back. No use of accessory muscles when breathing. Patient's back is also a 2:1. Shoulders are squared with the hips, and the thorax rises and falls with breathing. We're going to do some auscultation. Can you please scoot back for me? Kind of palpate this area. The trachea is midline. Muscle mass is good. No signs of any nodules, lesions, or masses. We're going to do a systematic auscultation starting at the apex. Go ahead and take a deep breath in. Deep breath in. Go ahead and cross your or hug yourself for me. Deep breath in. 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 Breathing sounds were heard clearly throughout. There's no signs of any crackling, wheezing, or rhonchi. Can you please have both arms in front of you? You're like this. We're going to check the lateral. Starting at the right side, we're going to move systematically as well. Deep breath in. 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 And deep breath in. All 7 landmarks of the lateral auscultation were clear without any signs of adventitious sounds such as crackling, wheezing, or rhonchi. Now we're going to move on to the anterior. Deep breath in. 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 8 landmarks of the anterior were also clear of any adventitious sounds. Clear breathing was heard throughout. No wheezing, crackling, or rhonchi. We're now going to move on to the heart auscultation. Looking at now, your chest is free of any random pulsations. We're going to check your AP ratio, or not AP, apical pulse. Apical pulse is normal rate and rhythm, no signs of tachycardia or bradycardia. Rated at a 2 plus, and it is a 84. We're going to compare that to the brachioradial. Brachioradial pulse is bilaterally symmetrical, normal rate and rhythm, rating of a 3 plus, also 84. We're going to auscultate the heart using the diaphragm bar stethoscope first. We're going to go second intercostal right sternal border. This is the aortic. S1 and S2 are heard. S2 is louder than S1. No S3, S4 sounds. Pulmonic. Second intercostal left sternal border. S1, S2 sounds are heard. S2 is louder than S1. No S3, S4. Now Erb's point. Third intercostal left sternal border. S1, S2 sounds are heard. No S3, S4. Tricuspid, fourth intercostal left sternal border. S1, S2 sounds are heard. S1 is louder than S2. No S3, S4 sounds. Fifth intercostal midclavicular line. This is the mitral. S1, S2 sounds are heard. S1 is louder than S2. No S3, S4. We're not going to go on and redo that, but using the Belloper stethoscope. Aortic. S1, S2 sounds are heard. S2 is louder than S1. No S3, S4. No heaves, thrills, or breathes. Pulmonic. S1, S2 sounds are heard. S2 is louder than S1. No S3, S4. No heaves, thrills, or murmurs. Erb's point. S1, S2 sounds are heard. No S3, S4 sounds. Tricuspid. S1, S2 sounds are heard. S1 is louder than S2. No S3, S4. No heaves, thrills, or murmurs. Mitral. S1, S2 sounds are heard. S1 is louder than S2. No S3, S4 sounds. No heaves, thrills, or murmurs. Alright, now we're going to move on to the abdomen. Can you please lay it down for me? We're going to raise the bed up to working height. We're going to divide the abdomen into 4 quadrants at the umbilicus, vertically and horizontally. Taking a look at the abdomen, the color is consistent throughout. There's no signs of a bowel distension. The shape of the abdomen is flat, both from the side and from the front. We're going to first start off with some auscultation. Using the diaphragm of our stethoscope, we're going to start with the right lower quadrant. We hear normal peristalsis sounds that are high pitch and gurgling every 5 to 30 second intervals. No hyperactive sounds or Borborygmus sounds. Right upper quadrant. Normal peristalsis sounds, high pitch gurgling every 5 to 30 second intervals. No hyperactive sounds. Left upper quadrant. High pitch gurgling sounds every 30 seconds. No hyperactive sounds. Left lower quadrant. High-pitched gurgling sounds in intervals of 5 to 30 seconds, no hyperactive sounds. I'm not going to percuss the areas, the 4 quadrants. We're going to do about 2 to 3 percussions per area. Tympanic. Tympanic around here with the area of dull in the right upper quadrant where the liver is. Left upper quadrant, also tympanic, left lower quadrant. Tympanic. Now we're going to do some palpation. I'm going to do a light palpation first. Let me know if you feel any pain or tenderness.
Okay.
Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Patient reports no pain or tenderness. Now we're going to do a deep palpation. Let's go a little bit deeper. Let me know if you feel any pain or tenderness.
Okay.
Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. No pain or tenderness?
No pain.
Patient reports no pain or tenderness, no signs of enlarged organs, and no signs of pancreatitis. We're now going to move on to the lower extremities. We take a look. There's no signs of any edema or erythema. Color is consistent throughout. I'm going to feel the tibia, no signs of any edema there. Feet are free of any stress ulcers or lesions. I'm going to check the dorsal pedal pulses first. Dorsal pedal pulse is normal rate and rhythm, rating of a 3+. Now the posterior tibial. Normal rate and rhythm, bilaterally symmetrical, and rating of 3+. Capillary refill on the toenails are under 2 seconds. The toenails are pink in color, free of any splitting or ridges, and they are smooth, except for this toe right here where there's a sliver missing. I'm not going to check the fine motor functions of your feet. Go ahead and tap your feet quick for me. Now go ahead and draw the number 8 with one foot. Now run your foot down the opposite shin. Perfect. Go ahead and sit up for me. Scoot a little bit back so your feet are dangling. We're going to assess your deep tendon reflex. You feel for the patella. We're going to do a strike. Just freely have your legs. Deep tendon reflex is a 3+. We're now going to lower the bed all the way down. And go ahead and stand up for me. Taking a look at the patient's spine. The thoracic is convex and the lumbar is concave. Go ahead and bend over and touch your toes for me. Back is bilaterally symmetrical. Palpate the spine. It is midline. No signs of scoliosis, lordosis, or kyphosis. Stand back up for me. We're going to do a Roberts test. Go ahead and have your heels together. Close your eyes. No signs of swaying. Patient has a negative Roberts test. Good. Now go ahead and face this way. Go ahead and walk forward for me. Patient has a normal gait. Arms are swinging in tandem. No hesitancy. Now go ahead and go heel to toe. Patient has good gait. Able to walk heel to toe and maintain balance. Go ahead and come back. Awesome. All right, now go ahead and stand here. I'm going to be right next to you. Close your eyes and lift one leg behind you. Patient has good balance. And lastly, I'm going to have you hop on one foot. Perfect. Okay, that's going to do it for our physical assessment. You're all done. You go ahead and put your shirt, socks back on. The doctor's going to be in soon. Go ahead and take a seat. And I'm going to go document these. We're going to go clean up. And yeah, we'll see you in a little bit, okay?
Thank you.
Thank you.